Is depression real? When were the first cases of depression diagnosed? Today, I want to answer these questions by sharing the history of depression. But let's first watch this clip by Andrew Tate.
Say something. Depression's not real. Feeling depressed is real. So you can feel depressed, but you feel depressed, and that is a natural biological evolutionary trigger for you to change something in your life. That's your own mind telling you you're unhappy about X. If I went to jail today,
There's a lot to say about this clip, but I don't want to waste time because I have to discuss the history of depression, which is very, very long. So let me start by saying that he here is acknowledging that feeling depressed is real and that unhappiness, he mentioned unhappiness. So unhappiness and feeling depressed are more of like one symptom of depression. Depression is much more than that, and a lot of people who have difficulty differentiating depression from normal sadness is because they think depression is just sadness or unhappiness. And sometimes they see someone suffering from mild depression and they see them coming out of it, and then they are like, oh, it's not real. They just come out of it by working out. So depression is real, but at the same time, it's one of the most treatable conditions. So I see Andrew Tate say a lot of time, he say things like that. Let's watch another clip.
depression isn't real. People say, oh, you don't understand. I understand very well. And me deciding that depression isn't real is how I prevent myself from ever feeling depressed. I've only constructed that mental model because I've been in situations in my life where I felt depressed. I'm saying depression isn't real because I've been very depressed. Life as a man is pretty shit, and you're gonna feel shit for a pretty large percentage of the time.
Seems like he has some fears about depression, and he has some fears about getting his power away from him, and he thinks that if he does believe or he does acknowledge depression, it's so powerful that it's going to take his power away, and this is not true. Again, I want to say, is anything real? There is like one train of thought that say that everything is a simulation and nothing is real. It's as real as we make it through our mind. So if that's the case, nothing is real. But if everything is real in our mind, then depression is real as well. So I also want to say a little bit about Dr. Joe Dispenza, who treated his back spinal injury just through meditation. When doctors told him that he can never walk again unless he gets surgery done, but he's perfectly fine now just by using the power of his mind. So our mind is very powerful, and we can I just don't want to go on a tangent, but again, like if a lot of things that we think are real are not real. So in that case, depression is not real, but nothing is real. But if everything else is real, then depression is real too. And a lot of time people have difficulty understanding that depression is real because it is treated by lifestyle modification, especially mild to moderate depression. But a lot of other conditions people don't know can be treated by lifestyle modifications. A lot of other medical conditions like diabetes, high blood pressure. We can even prevent certain type of cancers by our diet and our lifestyle modification. Also like things like sleep apnea, which seems so real. Just because something can be treated just by lifestyle modification doesn't make it not real. So how I'm going to prove today that depression is real is because if something is real, it will not go away. No matter how much you say, no matter how much big influencers like Tate say that it's not real, I'm not going to believe in it. No matter what anyone will say, it will stay with you from generation after generation after generation. So that proves that depression is real because it has been documented in very, very ancient civilizations, and it continues to be documented throughout history. So without further ado, let's get started. I also want to mention that I get so many comments about no, depression isn't real, this and that, and in one of the video that I do recommend you watch when I talked about depression, when a psychologist was interviewing Andrew Tate. In that video, I did mention that If my viewers want, I'm going to make a video on history of depression, and one of you actually did requested it, so I want to put the comment here, and here I am presenting to you the history of depression. When was depression discovered? The earliest accounts of depression were found in 2nd millennium BCE in Mesopotamia, which are the very ancient civilizations. And at that time, depression was considered more of a spiritual issue rather than a medical issue, and it was treated by priests. It was also considered as demonic possession of a person. So the idea of depression caused by negative evil spirit has been going on in many ancient civilizations, including Greek, Romans, Chinese, Egyptians, and Babylonians. And because of this belief, it was at that time was treated by things like physical restraint, beatings, starvation, and isolation. And the purpose to do those things was to get the demons out. Even at that time, a lot of people, even though believe that it has a spiritual and demonic cause, Greek and Roman doctors started to believe that there is a physical and biological root in depression rather than a spiritual one. So Greek and Roman doctors started to use things like music, sound bath, and a medication that included poppy extract and donkey's milk. They started to use all those things to treat their patients. So you can see even some of those things are even considered now as treatment of depression, especially when it's a mild one. Let's come to ancient Greek and Roman times. Hippocrates, who is a Greek physician and he's considered father of medicine, he was the first one who named depression as melancholia. So let's find out the meaning of melancholy. I do know the meaning, but I want to just search the exact meaning and present it to you. So it says a feeling of pensive sadness, typically with no obvious cause. So he's one of the smartest person in history, and he thought he figured it out that it's sadness without a specific cause, and it's extreme sadness. And that's what depression a lot of time is, that the person's life is great, everything is going good, and they just don't know that why they are feeling so down and depressed. So he was the first physician to name depression something, because depression did not even have a name in the past. So he called it melancholia. And he believed that it's caused by imbalance of 4 body fluids: yellow bile, black bile, phlegm, and blood. And he thinks that melancholia is caused by having too much black bile in the spleen. So the first person to actually find out a biological cause of depression or melancholia at that time. And the treatments he used were bloodletting, baths, exercise, and diet. So besides bloodletting, baths, exercise, and diet, it still plays a major role in treatment of depression. It's considered lifestyle modification, and it's very effective. So then a Roman philosopher and statesman called Cicero believed that melancholia has more psychological causes such as rage, fear, and guilt. Guilt is a big part of depression. A lot of you may not know that one of the symptoms of depression is excessive and inappropriate guilt. I'll give you an example. The person who is depressed may feel that things they haven't even done, things they are not even related to, it's somehow their fault and they are responsible for that suffering. Middle Ages. During this period, mental health conditions are still considered to have spiritual and demonic causes, but a Persian doctor named Rhazes in 865 to 925 CE did see depression being arising from brain. He recommended treatments as baths and a very early form of behavior therapy, which involved positive rewards for appropriate behavior. During the Middle Ages, religion, especially Christianity, dominated European thinking on mental illness, and again people start attributing it to devils, demons, witches, and started using exorcism exorcism, drowning, and burning as popular treatment methods. Some people were even locked up in asylums. Even during that time, doctors were trying to figure out physical causes of depression, but those doctors were a minority. During Renaissance, which began in 14th century in Italy, doctors started to revisit the theory that depression has a more of a natural cause than supernatural cause, in which he outlined social and psychological causes of depression, such as poverty, fear, and loneliness. In his book, he made recommendations like diet, exercise, travel, purgatives to get rid of toxins, bloodletting, herbs, and music therapy for treatment of depression. In 18th and 19th century, the rise of the field of psychiatry gave us a better understanding into the condition called depression. And the term depression started to gain popularity around that time. And it was characterized by a range of symptoms, including low mood and emotional distress. Treatment during this time include water immersion, staying underwater for as long as possible, and using a spinning stool to put the brain contents back into their correct positions. Additional methods were diet changes, enemas, horseback riding, and vomiting. So during that time, Benjamin Franklin also reported to develop an early form of electroconvulsive therapy, which is also commonly known as shock therapy, which you may have seen in some movies, but they show it in a really bad way. It's done very differently recently now, and it's still a very effective treatment of depression. So in 1917, the Sigmund Freud era, Sigmund Freud, who is considered the father of psychiatry, he came up with psychoanalytic explanations of depression. And Sigmund Freud wrote about mourning and melancholia, where he theorized that melancholia is a response to loss. Either it's real or symbolic. So real can be like a loss of job or death or a loss of relationship, and symbolic can be failure to achieve a desired goal. And Freud believed that a person's unconscious anger over the loss leads to self-hatred and self-destructive behavior. So a lot of what Andrew Tate was saying, kind of, you can see that in this theory. So all of that are causes of depression. So just because the cause he thinks is in his mind doesn't make the problem not real. That's what I just don't understand Tate's theory, because seems like he is agreeing with depression, but he's disagreeing with depression. So I just don't know. He seemed more confused. He does seem to understand there's something out there, but just because he thinks that he is giving power, like he just doesn't want to lose his power in hands of depression, he doesn't even think is real. So part of him does believe that depression is real. So that's kind of explained by psychoanalytic theory too, that Sigmund Freud explained in his theory. But everything that is going on is on an unconscious level. We are not aware of that we are doing it unless we reach our unconscious in dreams. We can reach our unconscious through meditation. We can reach our unconscious through journaling, through psychoanalytic therapy, but psychoanalytic therapies are very time consuming, so a lot of people are not interested in doing it. We also can reach our unconscious through therapies like hypnotherapy, through breath work. There are a lot of different ways we can reach our unconscious, and all these fear and self-hatred that can cause depression, they are all buried in our unconscious. They are not at our conscious level. So that was his theory, and he, according to Freud, he felt psychoanalysis can help a person resolve these unconscious conflicts and reduce their self-destructive and behaviors. Even during that time, other doctors did believe that it's a brain disorder. So in 1960s and 1970s, there were cognitive explanations that came for depression, and the cognitive theory is very popular. Aaron Beck, he proposed that the way people interpret their negative events could contribute to symptom of depression. So he believed that automatic thoughts and our negative self-beliefs and errors in processing information were responsible to depressive symptoms. So according to Beck, depressed people interpret events around them in negative ways and view themselves as helpless and inadequate. So it's similar to what Tate was saying too, that people start feeling that they are helpless and they are inadequate, and they just have a very negative way of processing all the information. And we do see that in depressed people, that they have a very negative perception of themselves and of the world, as well as things going on, events going on around them, and how people are reacting to them. They perceive everything very negatively. So the cognitive models of depression led to development of cognitive behavior therapy, which is very popular in treatment of depression. In 1970s, the medical model of depression developed, and it suggested that all mental disorders, including depression, has physiological causes. So the medical views started to see depression exactly as a medical disorder, just like other medical disorders like diabetes, high blood pressure, and suggested that these disorders like depression can be treated by a medication. Biological factors in depression focuses on genetics, brain chemistry, hormones, and brain anatomy. So these models led to development of antidepressant medication treatment. I also want to add, I missed to mention lobotomies that gave psychiatry such a bad name. They just didn't know how to treat like depression and other mental disorders, and physicians were just feeling desperate. And what they find out is that doing lobotomy, which are surgeries to destroy the brain prefrontal lobe, tend to have a calming effect on the person. Lobotomies usually cause personality change and a loss of decision-making capacity. It also causes poor judgment. It also causes death. The person, if they didn't die, they were just like zombies. They were calm, but they were like walking zombies. In 1950s and 60s, doctors divided depression in two different types, endogenous and exogenous depression. So exogenous depression is when someone is feeling depressed because of an outside cause, and endogenous depression is when someone is feeling depressed without a cause. So in 1950s, doctor discovered that a medication that was used to treat TB or tuberculosis, which is called isoniazid, which I think gained popularity during COVID too, because they thought like it helps with COVID. But they figure out that medication helps with depression. So that's how everything started, that a medication can actually help with depression. That led to all the research that was started in antidepressant. So that finding led to more research on finding out a medication for depression itself. Just like it happens a lot of time, like there is a medication that come out for one disorder, and then researchers or the clinicians figure out or realize that it helps with other things too. Like Viagra came just like that, and then newer medications for diabetes like Ozempic. It was not for weight loss, but then it was one of the side effects, and now it's been used for weight loss. So that's not uncommon in medical community, that medication to treat one disorder, and then it is realized that it's helpful for treating some other condition too. And then we direct our research to come up with a medication that is similar to that medicine, so we can treat the other disorders. So that's how research started on finding out a medication to treat depression, when they realized that a medication for tuberculosis was actually helping with depression. So one of the first medication that came out for treatment of depression was imipramine, tofranil. It's still being used, not very commonly, but still being used. It's one of the older antidepressants. And then it was followed by a number of other medications that are considered under the category of tricyclic antidepressants. They are still very effective, but they are not very commonly used, again because of some side effects. The side effects most commonly are weight gain, weakness, and the worst one that I don't like is potential of their lethality in terms of overdose. Because when a person is severely depressed, they are always at high risk of committing suicide. The antidepressant, if they take a lot of it, they can actually kill themselves. This type of antidepressant It's called tricyclic antidepressants. So then other antidepressant came out in 1987. The first SSRI, Prozac, came out, and then after that, a lot of other ones, including sertraline in 1991 and paroxetine in 1992 came out. And they are called selective serotonin reuptake inhibitors. Again, they have a really bad name also. I know they do work when someone is severely depressed and there's nothing is working. It does help them to come out of that acute phase. What I see is that when someone is mild to moderately depressed, they can work on lifestyle modification and come out of that episode of depression, and then can maintain their active, good lifestyle to prevent future episodes. But when someone is in moderate to severe depression, it's just really hard for them to do all of that, because depression can also cause difficulty with movement. Like it feels like they are carrying brick on their shoulder when they are moving. Everyday activity becomes that difficult. So for severe depression, usually we do need a clinical intervention. It's not always have to be medication. It can be counseling too, but combination of medication and counseling works the best. So when someone is in severe depression, usually definitely they need some help with clinician or someone who is trained in treating depression, so they can come out of that episode, and then they can use those lifestyle modifications to prevent future episodes. So in past couple of decades, newer antidepressants came out that are called SNRIs, Wellbutrin. They do affect dopamine and norepinephrine. So there's one which is Wellbutrin, then there is desvenlafaxine, a lot of other ones. There are so many. Around that time, depression was considered a chemical imbalance. And where is the future going? So now the chemical imbalance theory is rejected, and we think depression is caused by brain not being neuroplastic, when one part of the brain is not able to communicate effectively with other parts of the brain. When different parts of the brain are communicating very, very smoothly, then the person feels good. But when that connection is broken, then a person feels depressed. So that's why we are having a lot of research on expedited research on psychedelics, because they are considered to improve that neuroplasticity. So in the future, we are definitely expecting some better treatments and better understanding of depression. So you can see depression was present in earliest civilizations, and even now we don't know what exactly caused depression. We are still puzzled by depression. Why? Because mind is extremely complex. What makes it complex is that what you know is not only what you know. A lot of it is in our unconscious level too, and that's how psychedelics work, because by taking those, our unconscious comes to our conscious attention and our conscious mind takes a backseat. So anything in which we can access our unconscious helps us gain a better understanding of our mind. And this is my personal opinion from all my work and all my research that I've done and all of my experience, that everything that we want to treat depression or to treat our suffering and misery is buried in our unconscious. So we have to bring them to attention. If we are not aware of those things, how can we fix them? Or how can we process them? So we have to become aware of those things, and only then we can process them, because first thing is awareness. So I know I'm going on a tangent, but I can talk about it for a day. Please let me know if there's something I miss, or if there's something that caught your attention and you want me to explain it further. Thank you again for watching. I'll see you next time.